Okay, hopefully. All right. I have an eyeball, so that says that I'm live somewhere on Facebook. Perfect. Okay. Thank you for those of you joining me today. I'm just going to give everybody a minute here to tune in. Okay. Perfect. All right. I see a few of you starting to tune in here. Mary says she finally found. Mary, thank you for commenting. Let me know if you can see and hear me on the other end. I'm going to share this elsewhere. Are joining me today and you'd like to comment, I've invited many of you to come comment, and especially for those of you in my groups that are managing lipedema right now or suspect you may have lipedema, Durkheim's disease, whatever the condition, I would like you to, as part of the awareness today, make a post in the comments. I'm just posting this up in case anybody's lost. Okay, perfect. Okay, I see a few signing in here now. Great. Okay. Well, for those of you who are joining me, thank you for being here today. It is one of my bigger sessions of the year. I'm wearing my official Lipoedema Awareness shirt. It's probably not one that everyone is familiar with, but there's a gal in my group named Carmen, and a number of years ago, we did a whole virtual conference for the Lymphedema Association up here in Canada. And this is a design from Carmen's Etsy store. So the official color purple is definitely about lipedema awareness, lipedema butterflies. There's all kinds of themes and symbology around today. Today, we're going to talk about a few things. I wanted to break down some stigmas, and I also wanted just to give you guys some self-care tips. The big thing with lymphedema is congested lymph, compromised lymph, lymph that's not flowing properly, and there's a lot of tools that Lifepro has that can make that an easy task for you. I interviewed a gal last year for Lipoedema Awareness Month, and she runs a large group. Hello, Marianne, if you are joining me in the Australia region, the Lipedema Warriors. And when we were speaking, you know, self-care is kind of a trend word right now, and everybody's talking about it. And she described it best to me when she said, well, everybody should be doing self-care, you know, physical, mental health, you know, the pursuit of good health. But it's all the lipedema care you got to do on top of all this that can really be sometimes a bit of a drag. I'm blinding myself a little bit with the lighting here, so I'm just going to turn this down. So today we're going to talk about easy ways to move lymph, using, you know, what tools you have at your disposal. And for those of you that are familiar with me and my group, yes, there's many more joining now. Hello, Mary. Hello, Irene from New Zealand. Thank you so much for being here. I'm going to get to a little bit of a presentation and a talk, and then we're going to jump over, and I invite you to make a comment. For those of you that are joining me from elsewhere, or from my groups, or, you know, maybe you're here doing some homework and some research, I would really like to keep this post boosted on Lifepro's page and share for those of you that maybe suspect you be dealing with something. You know, some of the things that Debbie talks about in her group or some of my members discuss seems familiar. Not everyone has a diagnosis. I would say 70 to 80% of the people that I deal with in the lipedema community do not have a diagnosis. It was just acknowledged in the US a few years ago. It is not acknowledged in many countries, including Canada. So you can't get a diagnosis if the condition doesn't exist in your healthcare system. So for those of you that are joining me and know what I'm talking about, for those of you that are joining me from Lifepro's groups, please tell me where you're joining me from today. I've invited everybody across the globe that I have access to. And for those of you that are in the know, I want to encourage you to share, to help others be aware, not just of the condition and what the standard definition it is. If you go into the group event that I set up for today, you'll see there's a whole bunch of these really fancy moving purple videos with some interesting lipedema facts I thought I would share. It is different than lymphedema, but certainly there are many that are dealing with both conditions. And the common link is lymphatic issues. The biggest way that you can help your life and the symptoms that you are managing is through self-care, consistent self-care. And where Lifepro becomes such a viable tool is, of course, these things are affordable and they're designed for your home use. So my members that are seeing awesome results with their own self-care have the ability to use their tools at home regularly as symptoms present. When you move, lymph moves, and I say that a lot. However, there's a lot of tools that can assist you in getting that lymph moving regularly. So what is lipedema? Anyways, Debby, why is my group called Fat Disorders? I take a lot of grief off of calling it fat disorders, but when you don't know lipedema exists, or lymphedema, or Derkim's disease, there's lots of different what are actually classified as loose connective tissue disorders. Some call them adipose tissue disorders. There's not a consensus globally on this, and that's where some of the confusion, even the spelling, if you're on this side of the globe in North America, lipedema is spelled differently than if you're across the pond in the UK, Australia, New Zealand, and those areas. So the condition itself is best described as painful and irregular looking fat. You know, you're doing everything you can between the diet and the exercise, and you're hydrated and you're sleeping, and you know, it's just not having an impact. You may have lipedema. It is a medical condition, and it's characterized by unusual, I wrote this down because I didn't want to trip on my own tongue, characterized by unusual fat growth and body shape, primarily affecting females. Not saying there are not guys out there that aren't dealing with lipedema. Certainly Derkim's disease, it is more prevalent, but it is primarily affecting the female population. It appears most commonly, the most common place that you'll see it is in the legs. And I know a lot of you are out there going, yeah, I know, I've seen it a million times. Again, I don't want this being confused with lymphedema. Lymphedema is a different condition. Lymphedema might just be one leg or one calf or one foot. It doesn't necessarily have the symmetrical representation that lipedema does. So if you've ever seen someone with uniform but large or oversized legs in comparison to the rest of the body, not as common, but it does present in the arms, the torso. I've seen Derkim's disease in the head, in internal organs. You know, so there's a lot undiscovered yet about these disorders. The common link, and the reason my group is called Fat Disorders, when you're seeking information, when you're looking for information sessions on how to manage self-care for these things that you don't quite understand, you don't go into the internet and say, oh, I wonder if I have lipedema. I wonder if I have a loose connective tissue disease. You just know that it's painful fat, or there's something wrong with your fat. So the reason my group is called Vibration for Fat Disorders is there's a lot of different disorders under this umbrella. And I want people to find and get to the resources first. And through that process, they're going to learn the technical terms. They're going to learn the proper language. And I appreciate the feedback I get from those of you that are versed. But a long time ago, when you were looking into this condition, you may not have been aware of what it was called. So it's about getting the information found is the reason I did refer to it as that. So a couple ways that you can make the living and managing this condition. And the one common thing, regardless of where you are in your diagnosis process, whether you've been dealing with this 40 years, 5 minutes, whether this is the first time you've heard about it today, is lymphatic fluid. So there's usually some compromised, sluggish lymph fluid vessels that are not expediting the fluid out of your body. And over time, it becomes hardened. It can become painful. There are nodules that develop, lymphomas. These things can be very painful things to manage while trying to live your day-to-day, work your life, raise your kids. So self-care really is the biggest advantage. And you do not need a diagnosis to improve self-care. Even if you have a diagnosis, nobody's going to come to your house and do the self-care for you. So self-care in the lipedema world means something different to everyone. And a lot of it is based on where you're at with your condition. Perhaps you've had some surgeries. Perhaps you've got other things going on. It's pretty rare when you're dealing with a chronic issue that you're dealing with one thing. Ehlers-Danlos syndrome is very common in this community. POTS, mast cell activation syndrome, hypermobility is a very common symptom, swelling, pain. There's a lot of common associated symptoms that are common to lots of conditions out there, rheumatoid arthritis, MS. So sometimes when you're seeking a diagnosis, this condition at the medical level, it is not known. It's not well known by everyone. And the standard of care was really just created a few years back. So it's going to take some time and some advocacy to get this information out there. So when you're going to speak with your average doctor, they likely are not aware of this condition. So I'm going to post some stuff after the live today. I'm going to post a link to the standard of care for the US. But I want to stress that it's not about getting a diagnosis. I don't want you spending the next 5-10 years going through this stressful process of trying to find a doctor, getting on airplanes and spending all this money to get a diagnosis. You're still going to have to do the self-care. So what else do I want to bring to a highlight before I get into some tips here? So this condition, I'm going to bring it up, but I know it's going to be a talking point for those of you that are versed. It can be progressive. I know some that have never progressed, and is it due to the self-care? Is it due to the genetics? It could be related to a lot of things. Some progress in different ways, but very commonly it is in size. And I said today that I was going to break down a couple of the stigmas in this community, and two of the big stigmas that I want to focus on that so many of my members have had success with using Lifepro products because they're affordable. Again, when you don't have a diagnosis, getting access to medical grade tools can be a challenge. You've got to justify why you need it. So for the less than the cost of your deductible, and in the case of many of you, what your monthly plan costs, we're going to talk about some things that can help you with that situation. But the two big stigmas are that you cannot lose weight if you have lipedema. And it's also that you cannot tolerate heat if you have lipedema. Many of you, this is the case, and this is your own personal experience. I don't want to take away from that. But we're speaking about a very large number of the population. How common this condition is estimated to be 1 in 9 to 1 in 11 women on this planet are affected by this condition that virtually is an unknown. So I haven't, in my 20 years of working with vibration plates and in my 6 or 7 years in the lipedema supportive capacity community, I've never seen a study. I've never seen any documented evidence where it's absolutely definitive that you can't lose weight and you can't tolerate heat. And I see so many of you, thousands and thousands of you, that are having success in losing. The obesity fat can be lost. I've seen it time and time again. Diet is your biggest friend with that. But of course, the activity, moving that lymph regularly is really, really key. So, whether you can or cannot lose weight is very much an individual thing and something that you're going to have to approach as a topic on your own. But I don't want anyone, logging into a group or seeing a comment online and feeling defeated because someone has shared something that probably came from a very qualified professional. But as someone that supports many of these qualified professionals and deals with them regularly, it is definitely a hot topic of conversation. But no one can give me anything definitive saying it's absolute, been studied and proven that you cannot lose weight. And there's enough empirical evidence in Lifepro's group, my group, and many of the lipedema groups out there that that's just not the case. So there you go on stigma number one. Stigma number two is probably a little bit more of a sensitive topic, if you can believe it or not. But can you tolerate heat? Debbie's got infrared sauna blankets and red light therapy out here. No, lipedema can't tolerate heat. Again, for as long as I've been supporting this community, I have a lot of people telling me this, making claim to this, but no one has given me any hard evidence or something that I can qualify to back that claim up. What I do have is, again, thousands and thousands of you that are going, yeah, but wait a minute. Yeah, but with heat, it's all a tolerance thing. It's very individual, and nothing's saying that you have to get into a sauna and crank it up to max temp and spend the next half to 3/4 of an hour there. Many of my members, when they're starting light therapies, vibration plate, even their diet, implement small incremental changes. Don't overwhelm yourself and try and change everything that you've been known to do for the last 30, 40 years. Change is hard for us as people. And whether you have a condition or not, as a woman, we got enough going on in our brains, scrambling things around that, sometimes taking a smaller piece and digesting things one thing at a time are an easier way, not only to implement and get more proactive with your self-care, but it really helps with the consistency in doing it in the long run. So with any of the things I'm suggesting today, it's always about starting conservatively. And the first thing I want to talk about, of course, big surprise, is the vibration plate. Vibration plates are not a new trend. They're not a buzzword. They've been around for just about as long as I have, which is 5 decades plus. They kind of go in these cycles, and I think a lot of it has to do with the marketing. Sometimes it's all about bone density. Sometimes it's about weight loss. Today, it's about using vibration plates for lymphedema and any of the related fat disorders. Why? Because it's the easiest way on the face of this earth to move your lymph in an easy way. So even if you can't stand, even if you lack the ability to stand on your own 2 feet, there are ways that this plate can turbo boost the circulation in the lymph without you having to put a lot of effort forth. And for those of you that have those drastic good days and bad days where you literally cannot move, you can move the lymph without having to get in the car and go to the gym or walk around the block. There's lots of great ways to move your body. Many of you are fans of the pool and rebounders. The big message is to move that lymph and move it often. That's the biggest thing you can do to contribute to slowing the progression of this condition and dealing with those severe symptoms of swelling, pain, no energy. That's the best way that you can get that started. The advantage that a vibration plate has over many activities is it also gives you the benefit of weight-bearing activities. So it's going to keep the bones strong. If you choose to exercise on it, maybe you do want to work on some weight loss. Maybe you've just got a bad knee, or maybe you're just weak and you need to build up strength, balance, whatever the fitness goals are, a vibration plate can offer that to you. Whereas traditional activities, sometimes they just take too long or they hurt too much. And so many of you in this community, I referenced it earlier, one of the big symptoms is hypermobility. High impact, long distance, long duration things are just not tolerable for many in this community. So the first part of my little demo, if you haven't seen me do a vibration plate session at this, I already had it turned on. Many of you watch me regularly on Lifepro's page and, wonder why, what comes out of my mouth is different than the manual. And I will say that I probably contradict most people out there talking about vibration plates Certainly I contradict the manual, but most of what I'm dealing with in my communities are chronic issues. And with lymphedema, the high impact or big impact is very unkind when you're dealing with pain and when you're dealing with inflammation. So the first lesson I want to get across with a vibration plate, and I see it 20 times a day. Oh, just start slow. But okay, so maybe you start on a slow speed, but why are you going for the max time of 10 minutes right off the bat? Start conservative on your time and on your intensity. So don't go 10 minutes just because your vibration plate has a max preset time of 10 minutes. When's the last time you went for a walk for 10 minutes? This is a tool that turbo boosts lymph and circulation, but it also accelerates exercise benefits. So be conservative. And leading into my message earlier, when you move, lymph moves, I would prefer starting out that you use it often in short increments. So maybe you're using it 3-4 times today for a couple minutes to a cumulative time of 10. It's very, very easy to overdo this. So please follow my advice. I would rather you prove me wrong and say, well, Deb, I could go a lot longer and I was fine. That's great. But if you've overdone it, I don't want you being so depleted, tired, and in pain that it affects the next 2 to 3 days of your life. So short time frames starting out. You'll notice that I'm seated on a stool. If you are fearful at all, if you are in pain, if you are dealing with severe symptoms, or you are terribly deconditioned, sit on the chair for the first week or two and just get used to how it feels. Lesson number 2, I said be conservative on time and intensity. What is intensity? There's so many names out there in the marketing world, I can't keep on top of it. But intensity, using an oscillating vibration plate, oscillating is the primary movement. I challenge anyone out there stating otherwise to have a conversation with me publicly or private. But it's how we move across the floor. And in my opinion and experience, it is the best way to move lymph most effectively while giving you the balance and stability piece, which is another big thing that's important in this community. So intensity is simply this. Wide feet is more movement. Close feet is less movement. Keep your feet close, guys. Don't go as wide as the machine will allow you and crank it up to 10 minutes and not be expecting no consequences the next day. I know it feels awesome when you're using the plate and you can feel things moving and you feel very excited and hopeful because it's giving you oxygen and endorphins and all these things. And it's very easy to go 10 minutes because what's 10 minutes? But again, these are a 10-minute miracle machine. Don't go 10 minutes starting out, more like 3, 5 at max, and see how you feel and do more later. So one of the things I mentioned today in the post was we were going to prep the lymph before we get to too much action on the machine. And for those of you that's a foreign concept to, if you are dealing with sluggish lymphatic issues, known compromised lymph nodes, you've had some surgeries, whatever is causing your lymphatic system to be ineffective, the vibration plate super boosts lymph and circulation, as I already said. So if you're going to not listen to me and go 10 minutes and take on more than you're ready for, you need to make sure that your system is adequately prepared to handle and dissipate the additional lymph. So it's not uncommon that I get these questions about why are my arms so inflated, or why do I have no neck after my vibration plate session, or why can't I see my knees or my ankles anymore? If you have blockages along the way and you're moving vast amounts of fluid, you have to make sure that your body's got the ability. This is another reason to keep it conservative on time and intensity starting out. I recommend a closer foot position, and let's play with a mid speed. I don't want you to be afraid for going faster. Faster is going to feel a little smoother, less choppy. It's kinder on inflammatic joints, inflammation, pain, wherever it's presented. So bring the feet a little bit closer, hip width apart or closer if it feels like too much. And I posted a video in the event today. I'm following Jen Stewart's quick and dirty 6 pathway prep routine. And she was nagging me for a while, and I'm glad that she did because it's been in my brain ever since. If there's lots of different versions of how to prep the pathway out here. This isn't any one person's idea. This has been around for a long time. My certified therapists and my lymphatic therapists in particular know about prepping the pathways, and everybody's got their own way of doing it, just like I do the vibration plate. But the 6 areas I want you to sort of focus on, you can do this seated as a starting point. For those of you that are comfortable and bored with sitting, you can also do this standing. So I'm going to do this standing. For those of you that are not comfortable yet standing, or you need to break it up, keep the chair there. If you need to take a break or you've taken on more than you're ready for, you can always sit back down. For those of you that are brave and want to join me, bring your feet a little closer in the heels. You can angle your feet. It usually feels a little bit more comfortable. I want your knees slightly bent. How much is slightly bent? Well, if you're hearing all the shaking in your voice and your eyeballs and your ears are shaking around, you need to bend them more. Bend them till you kind of feel it no more than the collarbone, and you'll feel the difference. Okay, play with that. If at any time through your session your head's rattling, your body's cheating. It's always trying to make this easier. And just like on the floor, when you stand and lock your legs, it's a lot easier than when you stand and force the muscles to engage by bending your knees. So we're going to stand, whether you're seated or standing. We're going to take our hands and we're going to kind of just put them in behind the earlobes. And I want you gently stroking down from the ears up and down the sides of your necks. You can tap, stroke, whatever, rub a little bit, very lightly. We're just trying to stimulate the lymphatic vessels. We're not trying to give ourselves a deep tissue massage. Another common symptom in the lipedema community is easy bruising, and for weeks, and way worse than it looks on anybody else. So I don't want you being brutal, just stroking gently the surface. The vessels lie very low just under the level of our skin surface. So you don't need to press very hard, okay? The next area we're going to move to is the collarbone. So we're going to stroke. So I'm going to come a little closer. So you're sitting or you're standing. We're going to stroke this collarbone, or we're going to tap it lightly 10, 15 times. I know I'm not doing this as awesome as some of you, okay? For those of you, keep the comments coming, guys. Tell me why you're here. Next area we're going to go to is the pits. I'm an A cup, so I can do both of mine at the same time. You may need to do one side at a time. If you are joining me, I want to know if you know about this condition, what you know about it, what your self-care is, where you're joining me from. Let's advocate for ourselves and tell people a little bit about what you're dealing with if you know you have this condition. So we started on the neck, went to the collarbone, 10, 15 strokes or light taps for those nodes under the arms. Next area we're going to move to is, as Jen described it, just above the belly button. I place my fingers in my belly button and my thumb just under that V in your rib cage, and I put my fingers in the middle. And you can rub up and down, tap, put a little bongo drum, stimulate this area here, okay? Then we're going to move on to the groin. We just on either side of right on top of those ovary, girls. Rub here, tap, 10 to 15 taps, strokes, whatever feels good, okay? Then lastly, I want to move to the back of the knees. Guess what's another symptom of lipedema? There's an accumulation or a pocket behind the knees. Sometimes that's a telltale sign, okay? It also, with the swelling that occurs there, it can, a lot of people deal with Baker's cysts or it's misdiagnosed. Tap, whatever feels comfortable. Okay, some of you may have a more extensive routine. Jen did this one. It's doable. It's short. Do it however feels good for you, and not just prior to your vibration plate. Anytime that you're increasing lymphatic flow through activities, through therapies that you may be doing, light therapies, massage, some of the other stuff, it may be a good idea to prep those pathways and just prime your system for the flow that you're about to subject it to, okay? So we've done our little prep. One of the things I love to do standing on a vibration plate, no matter what the session is, I have hip issues and low back issues lately. We are going to get into what's the difference in, losing 20 pounds and just feeling better on the plate. So we are going to get into a very simple squat variation today. But to make the squat more manageable, to help, break up some of the sitting that so many of you do, just the body aches, the pain. Let's do some pelvic tilts or just get some movement going here. So I'm still at a mid speed. If you feel comfortable with your feet about hip width apart, that's ideal. Again, reminder, if you're feeling it in the head too much, bend the knees a little bit. For those of you that are seated or want to remain seated, or you need to take a break because I talk too much, do something. Move your feet, move your arms. You don't have to just sit here. Do other things while you're seated, okay? I'll show you an upper body tip soon. I like to do probably 30 seconds to a minute on the pelvic tilt, maybe some hula circles, just to loosen up my low back and my core. For those of you that do want to accelerate weight loss, you're finding you're weak in the legs, the strength is depleting, you're working on bone density. Standing here, so many of you are led to believe, and it's nobody's fault, it's the industry and the research not educating consumers properly. I'm sorry. You can just stand here, and I've seen people lose 50, 60 pounds, honest to God. But at some point in your journey, you can only start going longer and longer. And again, if the hypermobility and inflammation is an issue, how do I lose weight when I can only do this for a minute or two? Or maybe that's all you can tolerate. So a squat, if you're willing and able, your squat might look like this. It might look like this. Everybody's squat's going to be a little different. You have to pay attention to bad knees and bad hips. But try, if you're in one fitness position, a squat is going to engage and recruit the bigger muscles in the quads, the butt, and they're going to burn more calories, and they're going to elevate that metabolism, and they're going to make you stronger. By pushing your body beyond its normal comfort zone and ability, those bones are working harder. If you're just standing here, your body, your muscles, your bones are only going to do the bare minimum that they need to do to get the job done. If you start pushing yourself ever so slightly, the muscles are going to have to work harder. The bones are going to have to respond by laying more new bone to make them strong enough to do the exercise. So I do encourage you, especially for those of you with joint issues, you don't have to move up and down. You can just hold still, maybe do 2 to 3 reps. My favorite little move to recover or take a break between my reps is I stand up. Yes, I do lock my legs. Maybe I bring my feet a little bit closer, and I just bend at maybe a 45 or a little further if you feel comfortable, and let that low back recover a bit. Maybe I'm adding some more movement. What I want you to do, whether you are seated or whether you are standing, is experiment. It's very much a personal experience and how this feels, and the big caution is less is more, because the other big symptom, I keep coming up with symptoms, fatigue, no stamina, you can't do the long duration stuff. And one of the beauties about using a vibration plate in short, more frequent sessions, more like a spot treatment, let the symptoms drive when you need a fix. And I'll get onto some other tools here right away. But a vibration plate for 1 to 2 minutes is going to lift the energy. It's going to give you the stamina. So, using it before you step out the door and go to work, or, for a minute or two when you get home to get rid of the day and just lift your energy levels and move some fluid. So for those of you that are starting out with a vibration plate, certainly those with lipedema, lymphedema, Derkim's disease, but anyone that is dealing with compromised lymphatic issues, you want to make sure the body has the ability to handle the capacity. So number one reason to keep it conservative on time and intensity starting out. But those short, more frequent durations that you're using to manage the symptoms when the fatigue dips, when the legs are swelling at the end of the day, eventually the effects are going to start lasting, and you won't need to use it as often. And you'll also become more comfortable with longer durations. I would say more than any of the medical conditions that I support using vibration plates, which is a very broad spectrum. My vibration plate users in my fat disorders community that are using it for lymphatic movement, lymphatic drainage, whatever you want to call it, are my most consistent users. Therefore, I believe that's why they're seeing the best results, whatever goals it is you're looking for. The common thread is that lymph and circulation boost. Some are using it for bone density as well. Some of them are using it for their MS pain. Some of them are using it for their diabetes. There's all kinds of different reasons people are using a vibration plate to boost lymph and circulation. But in the lipedema community, particularly, this gives you the ability to move and bear mass, where for so many of you, I know that those regular activities are just not sustainable. If you're working to return to your activities, or you're finding that the activities you love, your classes or other things you may be doing, are becoming more challenging as you know, we age or our condition progresses, a plate is a great complement. It's not about replacing everything that you want to do or you love, but it can be a catalyst to get you back to them, or enjoying them with more pain. Use it as a warm-up and a recovery tool. To my therapists, to my doctors, to my surgeons, this is the easiest tool that I wish many more of you would embrace and understand. But as I said earlier, it is a physical experience. My most successful therapists and docs with vibration plates are ones using it themselves. When you understand how it feels, this itchiness that starts out when that thing starts moving. If you have severe itchiness, you may or may not have NCAS. Look into that. Another reason for short durations. But, you know, these things that your patients are experiencing using these plates are so positive. They want to share them with you. And if you haven't had a physical experience using a vibration plate, it's going to take 90% of the reading and the understanding on the research. Once you've had a physical experience, it's going to make so much more sense. So let's move on to other things, keeping on the theme of lipedema, associated disorders, but the theme of getting that lymph circulation moving and helping you ease that pain, okay? Massage guns. I didn't put this in my preview, and I'm embarrassed that I didn't. But next to vibration plates, probably the number 2 Lifepro tool that my lipedema members are using are a massage gun. And, you know, you kind of think, well, didn't you say that people with lipedema bruise like so much easier? Like a vibration plate, how I contradict the manual and everything that comes out of my mouth is completely different. With a massage gun, which is, you know, probably much more well-known than a vibration plate, there's this mentality that you have to be the masseuse and you've got to press so hard to, you know, I don't know why. You're not going for a deep tissue massage. Quickest tutorial of your life. How to use a vibration or a massage gun, which is a vibrational tool, without hurting yourself and making yourself black and blue, and never using your massage gun again. So regardless of what gun you are using, just like a vibration plate, crank it up to a mid speed. Don't start with the slow hammering speed. Crank it right up. And I'm going to come close here because I want you to see this. Okay, so this has 5 speeds. You can hear it. So if you are applying pressure, not only does it hurt me, but you can see how my arm is responding and I'm having to apply a lot of force. Many of you don't even have the grip strength to hold on to this thing. That's a great way to use a massage gun too. It builds hand strength just by hanging on to it and lymphatic flow. Maybe that's where you start. But for those of you that are able to hold it, see the difference here? See how there's almost like, I'm trying to get a good angle here. There's space between where the gun is impacting me and my arm. Let the gun do the work. Crank it up and just skim. As I said earlier, we just want to skim the surface. We're not going deep. Just like when we were doing our prep, we're not pressing so hard that we're leaving fingerprints. Just let the gun do the work. Skim the surface of the skin. working in the direction that your therapist has advised you to do. Okay? Don't press. Don't press. You'll be black and blue tomorrow. You'll be scared to death of it. Let the gun do the work. If you're dealing with lymphomas, because I know many of you are going to ask me this, I can't use a massage gun on my lipoma. I have women in my group that are doing around it and slowly working towards the center. Anything that you can do to move lymph and start getting some life into that area. I am not giving medical advice, but I have had many of my doctors work with many of my members, and we're seeing not only the size reduce, but some of them are breaking into smaller pieces and dissipating. Your tolerance and understanding on how to use the tool and modify it for your use, whether it's the gun or the plate, is absolutely critical. That's why I'm such a nag about the amplitude and the times and all those things, okay? So when you're selecting a massage tool, I had another piece of paper here. Oh, here it is. When you're selecting your massage tool, be very, very critical in the size of your hand and your strength. Don't go for the biggest, baddest model. A lot of times you can't pick it up and maneuver it. For those of you that think, oh, you know what, I've got a plate, but this would be like great for the office or when I'm traveling. That is a good thought. And that's where some of the smaller, the Dyna Mini, those type of models maybe don't come with the assortment of attachments that the larger guns do, but they're pocket sized, they're smaller, they're ultra light, they're more manageable, not just for the lipedema community where you're dealing with pain and swelling, but for a lot of my seniors, or maybe you're just petite and you have really bad arthritis in your hands. So when you're selecting a tool, whether it's a vibration plate or a gun, visualize how you're going to be using it. Do you want to be moving a 46-pound machine around your house 4 times a day because you're using it in 3 different places? Are you an exercise guru now? Sometimes going with a very simple, the basic operation of a waiver or a mini where it's singular movement. It doesn't mean because you're getting more movements or features that you're getting more benefits. It's about consistently using the tool, and oscillating is the number one movement. I do it all my sessions in oscillating because it's the most well tolerated by more new users. It feels more natural, and specific to today's session, it just happens to be, in my opinion, the best for getting that lymph moving. So that very similar approach with a massage gun that I do on a vibration plate. Bring the speeds up, let the gun do the work. Don't force it into the hand. And that's a common question I've been getting again lately. Something else that I want to talk about today is red light, infrared light. And so this kind of speaks to both of the stigmas I talked about earlier, weight loss and heat tolerance. Yes, many can tolerate heat. There's actually, if you search lipedema and red light or lipedema and infrared, there is some preliminary research, but I challenge you to expand, take the label away and put in more, what we're talking about, which the movement of lymph. So lymph and red light or lymph and infrared, and you're going to see there's a healthy body of research. It's softening the tissue. It's dramatically reducing pain and swelling. It's helping you sleep better. And for those of you that are maybe fearful or just maybe are not ready to consider a vibration plate physically, you're just in such a pace of pain or poor mobility, these are not only great starting tools, but as you evolve in your self-care, a lot of my sessions, I talk about how to add these tools together with your vibration plate to get more optimal outcomes, is what my therapist would say. But you get more results in less time at home. And with all this self-care time that you guys have to do, wouldn't it be great if I could cut it down in time and effort? So let's talk about red light first. There's a bazillion red light options. I've only brought 2 because one is a wearable One is a set it and forget it. You don't wear it. And the reason I break my red lights and my infrareds down than other people, and a lot of it is based on the applications that I'm using it for in my groups. So red light, crash course, is very effective at that skin surface. If you have lesions, you have open sores, it's really good at getting that layer of lymph vessel just under the skin surface. It's really helpful in alleviating pain, reducing swelling. Look me up. Don't take my words for it. These are all things that you're going to find online and very validated. But the world's come a long way since studies that started 30, 40 years ago. And with a lot of the products that Lifepro offers, you can afford to take these things home and use them more consistently. So just like the vibration plate, if you're using a tool that's helping with your pain, you're kind of going to want to use it when you need it. You don't want to get in a car and drive to some therapist's office and pay them $100 to use their sauna or their red light panel a couple times, because you could probably invest in one of these and have it paid for. So a wearable, the belt is probably one of the more common ones that many people are looking at. It's not huge total body, but it does cover a large surface area. You can wrap it around your neck, your shoulder, your tummy, your legs, your knees. It's a very versatile tool. But not everybody wants to put something on their body. So other options are things like the panels, the bulbs. You know, if you're very elderly, or perhaps you're assisting someone as a support, or their care provider, you know, perhaps you want to set it and forget it approach. So these are different things I want you to consider. There's lots of red light options. If you're dealing in a specific area, or you've got a chronic issue, you know, maybe some old car accidents, you got a bad thing in your neck, or maybe you blew your knee or your ankle out, and you're just prone to more inflammation in certain areas. Sometimes the wearables are a little bit more convenient for that regular treatment thing, but they're versatile enough that you can deal with other body parts. So a lot in this community are using it for the symptom management piece. Obviously, they promote lymph and circulation. They're a great way to combat the pain relief, get that lymph flowing, but they're not going to give you the exercise benefits that the vibration plate does. So, you know, stand and do, you know, things while you're wearing your belt or you're casting your panel upon you. Again, really depends on what you're dealing with. There are different intensities of red light. So within the belts and some of the torches, you'll notice with the new Pro Elite belts with the attachable batteries, they're only a 10-minute treatment time max, which is 30 on the regular Lever-Red belts. The new triple chip in some of Lifepro's red light products, currently most red lights out there within the little lights that you see in the products, there's an infrared or there's a red light. The infrared you don't see, but the red light is visual to our human eye. In the new products, there's a triple chip, which means there's a red light diode and there's 2 infrared diodes. So they're warmer. They are a little bit warmer, but they're designed for shorter treatment times. So a 10-minute session in the new Pro Elite, where you're dealing with higher wattage, you've got 3 times the illumination that standard LEDs offer. You don't need to use them for as long. So if you're looking for like short treatment time, you're busy, you don't have time, you got a million other things, you may want to lean towards those products. If you're looking for the relax, you know, time really isn't as big of a concern, you're going to use it watching a show on the end of the couch, you'll be just as happy with the original belts, but know that that's where the 30-minute treatment time comes with some of the original Lever-Red models. The panels also offer infrared and red light, and there's 2 different sizes with Lifepro right now, and they are amazingly robust quality. They're built really well. They're a little bit more of an investment, but I do find that this type of a product, if you are a therapist, if you're dealing with the general public, you know, you want that hands-off approach, you may want to lean more towards a panel style red light infrared option than a wearable that you're going to have to clean and cycle. And this sometimes is a better Also, if you have like a dedicated space, you know, I have a couple of things you can't see off camera here, some hooks that I have where I hang my panels while I'm doing my workout. It really sort of depends on how you visualize yourself using them. So just something to think about. The torches are also a high intensity, short term treatment. They're a 5-minute. The torches are great. I've got one right here. The torches are great if you are, you know, maybe you are on the go or you've got a chronic area, joint pain, you know, and you want relief right now. The torches are a great way to target area specific, but I wouldn't recommend, you know, something like this for total body, you know, pain or weight loss goals. There's never one perfect tool for every application, but the torches are a preset max time of 5 minutes because they are much higher intensity diodes. They're designed to be short, sweet treatment times. So just differences to keep in mind. Okay, so let's move on to infrared. I left the most popular product. I'm a vibration plate lady, but lately the most popular product that people are asking me about in my group is Lifepro's BioRemedy infrared blanket. It's got little armholes. So this is the entry level. There are a couple of other styles and options, but many of you want to experiment with heat. Many of you are using it now, but you don't necessarily want to get in the car and go use the box sauna at the gym. And as I preach, you know, the more that you can do at home, the more likely you're going to be consistent and effective in the long-term self-care of this condition. So for the naysayers, you know, instead of having to invest $3,000-4,000 in a box sauna, you know, this is under $200 Canadian. I'm not sure what the exchange is right now, but there's always some good deals between Lifepro, up to 30% off right now, and through Amazon. This is also more readily available in more countries. So you can get this through Amazon in Canada and the US, is part of the reason I wanted to talk about it. But this is very lightweight. So when you are dealing with lipedema and pain and poor mobility, you know, sometimes you need to treat yourself where you are. A lot of my folks like using this on their bed or in the recliner. You can adjust the temperature. So you may be not so good with high heat or long durations, but you can turn the temperature of this way, way down. Maybe you're starting at 5 minutes. Maybe it's 10. Infrared goes a little deeper than red light. It's deeper. You're going to find it's very soothing on arthritic joints. It's also very, very well known and very well researched for boosting lymph and circulation. It does have an edge for those of you that are looking at boosting weight loss. That, you know, sauna technology has been out longer than anything else we're talking about. You know, the incubators that a premature baby is placed in at the hospital is a little infrared sauna. So it's very safe, but it's understanding what your own tolerance and sensitivity is. So there's a wide range of heat settings, temperature-wise, that you can adjust on this. If you're like me and you're menopausal and you're going through heat flashes, you can put your arms out the holes. But there's so many people that have tried this expecting it to be the next thing that didn't work, and they're having tremendous results. And sometimes over time, the temperature setting, or you can tolerate more once your body gets used to it. The reason I nag on the heat and the weight loss is I've seen so much success. As I said, there's so much empirical evidence in my group of people that are benefiting from using these technologies, and combining them is not only going to ramp up your benefits, but it's going to save on the self-care time. So if you're looking at combining these, I always recommend starting with lymph. But whether you do a vibration plate before or after or during some of these technologies is just something I want you guys to experiment with. Lipedema is like I say, it's going to take a bit of time before it's as widely recognized, let's say, as diabetes or MS or some of the other conditions out there. But there is so much that you can empower yourself through self-care tools that are absolutely affordable and stop the progression, not only of the condition, if you know, that's what your doctor feels you're dealing with, but you can start living your life again. Less pain, better movement, better energy, better sleep, better detox, just better. If I haven't covered it all, this is about the 5th Lipedema Awareness session that I have done. I am going to post a couple from past years in the comments, but I really want to get to questions. If you are just joining me or you've been listening to me ramble and you haven't heard already say, part of how I want to increase awareness today is to get some comments into this live. Please tell me that where you're from. Do you know about lipedema? Have you heard of it before? Are you managing it? Do you have a diagnosis? What is your self-care? Any tips that you can offer for those that are just becoming aware of this condition. Maybe it's something that someone's dealing with themselves. Maybe it's someone in their life that they care about. Anyone that we can save the burden that many of you had to go through in this learning process. Please just share. And part of the spirit of sharing a little bit about yourself today, just for there's a huge community out there to support each other. And some of the best tips I get on using these tools aren't from Lifepro or things that I figured out. It's people like you at home experimenting in your own way. Sometimes it works out great. Sometimes you have a setback, but don't give up. There's always a way to modify how you use these tools, good days or bad. Pre-surgery, post-surgery, there's all kinds of ways that these can be an effective wellness tool, but also help you achieve the fitness goals. I don't want anyone believing that you can improve your situation. Too many of you have just proven me otherwise. And I'm blessed to be a part of this community. And thank you for those of you that are joining me today. So let's see who's here today. All right. Oh, there's a few of you. Thank you for joining me. And again, I'm going to stay here for a little while and answer some questions. For those of you, you may not have a question, but I do encourage you to comment and participate in today's discussion. So hello again, Mary. Thank you for letting me know that you found me and could hear me when this started early on. Irene is here from New Zealand. I've known Irene virtually through years, and she's always so positive and sparkly. And it's delightful to see your name here, knowing how far across the pond that you are. So I'm glad the times worked out for you guys overseas there today. Sally, hello from Australia. Thank you so much for being here. Irene is here from Stockton, California. Mary says she is from Ohio in the US. I think I knew that, but I probably had forgotten. Irene Brown is here from California. Vicky, big fan of your posts, and certainly a big fan in the VIP club. Thank you for being here. She's from Smoky Upper Michigan. You messaged me earlier today about the smoke, and I'm out in Western Canada, north of Calgary, closer to the Vancouver side of the country. So for those of you out west, take precautions. If it's too smoky to go outside today and do your walk, that's another way to use a vibration plate. Keep moving. That's going to be the key with this condition, guys. Linda says, what is about the itchiness about? I go without using my vibe plate for a while. It's an itchy experience. Itchiness is not uncommon. It's not necessarily a lipedema thing either. It's common to new users of vibration plate because of that boost of circulation and lymphatic flow that it presents. In this community, it can be signs of other things. Generally speaking, with conservative use, 2 to 3 times a week regularly, it's going to go away in about a week or two. But if you're just using it here and there and once in a while, you're not really giving the body and the systems a chance to improve and get past that. It's very much a newbie thing. If it is severe, there's 2 reasons it may be severe. You've overdone it. You've gone way too long or way too wide, and it's just like crazy itchy. And again, it's different. Not everyone experiences this, but most people starting on a vibration plate have some type of a pins and needles or an itchiness. If it is severe, it can also represent an underlying condition referred to as MCAS. Many in the lipedema community are aware. This is just another one of those things on the list. There's never one thing that you guys are dealing with, it seems. But it's broken down. It is mast cell activation syndrome. And what happens with this condition is not necessarily a vibration plate thing, but when you have an increase in lymphatic movement through exercise, through therapy, when you're dealing with MCAS, your body almost has an elevated histamine response. Some have taken antihistamines, some have other things like prepping the pathways. My advice as far as starting the therapies today is as I've given on everything else, keep it short, conservative, and more consistent. You do not need to endure 10 minutes of going crazy itchy. Just listen to your body. And I guarantee if you do stick with it, even a couple of times a week for a few minutes, you're going to notice, Linda, that it's going to dissipate and be non-existent. If you take a big hiatus, I say often in my sessions, you've been using it regularly and you're moving along, and then you maybe go on holidays or you just take a break for a couple of weeks and you get back on, you tend to jump back in the same veracity. You don't realize maybe I should, back off a little bit, but that itchiness, that pins and needles tends to return. And, that just goes to show that consistent use is going to keep that away. On a completely different side tangent, some do experience this, and it's also more related to neuropathy. So when you're dealing with nerve issues, which can be related here when you've got lots of swollen or thick fibrotic tissue, nerves can be pinched, they can be compromised, and it can affect your sensitivity and your sensation. So a lot of people, as the machine improves, and it does improve, there's too many people seeing it, the neuropathy symptoms, you start to regain sensation. A lot of times it's that pins and needles. Sometimes it's itchiness. Sometimes things are warmer. Your feet are ice cold all the time and the heat starts to return to them. The blood flow is improving. And also I must advise you, and it is generally short-lived, sometimes with neuropathy and lipedema pain, especially in the feet, it can be painful. As sensation improves, with these nerves, a lot of the reason they shut the communication from the brain off and you're not feeling things is because there was pain present. So just be cautious if you are feeling an ache or a pain. It doesn't necessarily mean that something's wrong. What happens to your muscles when you use them for the first time in a long time? They might be a little bit sore the next day. So be really, really cautious whether you're dealing with symptoms like neuropathy or you've got lymphomas or you're just dealing with poor lymphatic flow. Pain or achiness does not always mean something is wrong. A lot of you haven't gotten to a place where you've been able to exercise your muscles in the way that you'd like to or play the activities that you normally would. And when you return to activity and use those muscles, you're living in a chronic pain world or a chronic condition world. And sometimes the new exercising the muscles pain is confused as chronic pain because, sometimes it's been a while since you've got those muscles to a level of exertion, if you will. So stick with it. The machine is also very good at recovering. So if you are very, very sore, reduce the time, use the machine for a couple minutes in a moderate fashion and the pain will very likely dissipate. I hope that helped, Linda. Jody says, hello, everyone. I'm from Iowa and I have stage 3 lymphedema. Interesting. Thank you for sharing that. Everything I talked about today is just as relevant for lymphedema as it is lipedema. And there's a mishmash of both in my group, many dealing with both. I'm sure you're well aware of that, Jody. Vicky says, I love tapping before I get on and have an organic lymphatic cream I use after a shower in those areas. Everybody's got their great little tips. These are the kinds of things I love sharing. It doesn't always mean that there's surgery or something so dramatic at the end of this journey of discovery. There's so many good tips and ways people are managing and improving their situation. And, you have to just be a little bit brave and experiment with a few of these things to see what works best for you. Jody says, I have it in my legs the most. I use pumps on my legs. It affects me walking far. Pumps are a great tool. Lifepro has a whole line of air compression leggings. They are absolutely not medical grade, but again, for those of you that don't have, a diagnosis to get, perhaps some of the medical grade pumps, they absolutely do work wonders. They move the lymph. Many that are bedridden that I work with, maybe as a post-surgery situation, or the symptoms are just so severe at times. These are tools that you can use in your bed, in your recliner, that will act like that manual lymphatic movement, and they're absolutely affordable. What I would suggest for those of you that are using compression massage garments, and thank you for bringing that one up, Do the prep work before. Use the vibration plate before. You can also use it a little bit afterwards if you've been sitting and you got other things to do and you're a little bit stiff and sore. A few minutes before and after any of these therapies is just going to move more lymph and help you recover from what you've done during your treatments. Hello, Jennifer Free. So wonderful that you can join us. She says she finally got here. She's a bit late joining in from Perth, Western Australia, and I look forward to speaking with you on my page here very soon. Thank you so much for joining me, and she's probably one of the biggest people that would back me up on the impact that self-care can have, and she's probably more diligent than myself in many ways. But thank you very much for being here, Jennifer, today and representing your group, Lipedema Western Australia. Mary says, I usually do these 6 in the shower. Love it. I do too, actually, because that's kind of when my day starts before I head down the stairs to get to the vibration plate. And I hear my knees and my elbows cracking and popping on the way. So I'm mindful now. Jody says, replying to Vicky, where do you get the cream from and what does it do for you? I'll have Vicky send you that link for sure. Creams in general, especially certain times of the year when you're dry, we're moving circulation. And when you're doing some of the prep work, if you're doing a more intensive routine, it just makes it a little bit kinder for me on the skin surface. But there are some that have different ingredients. I'm not going to get into topicals today, but there's a lot of groups out there and a lot of suggestions I'm sure some will have in the comments here. Jody says, does the vibrating plate really good? I hear it can create blood clots. I disagree with that statement. I do hear it a lot. It can move blood clots. Any activity can move blood clots. So I do advise, to be honest with you, blood clots, for me personally, my contraindications are very different than Lifepro. I specialize in these machines for 20 years and just have different experience. Blood clots are not uncommon in this community, especially with the bruising thing. So I advise you, if you are dealing with known blood clots or are at high risk, please first have a conversation with your doctor, not just with a vibration plate, but with any increase in activity that's going to boost your blood or your circulation flow, the lymph flow, just because it is not an uncommon thing in this community. Whether you can use a vibration plate or not really depends on what you and your doctor decide as far as activities. If your doctor has cleared you to use a vibration plate and you are dealing with known blood clots, please keep your intensity minimal and your times short, and just be mindful to what your body is telling you. I don't want you turbo boosting 10 minutes of blood flow and things getting clogged up along the way with the lymph and you having a poor experience the next day. I would rather be transparent on that point. Vibration plates do not cause blood clots. It is a common misassociation, as I said, because they do move them. Anyone that has information that can prove me wrong or state otherwise, please feel free to share it. But I have not been able to find anything to date, although I do take a lot of heat about that. But I do passionately want to support those of you that are using these devices if you are dealing with known clots or any conditions. And just know that there's never one way to use these things. And it's absolutely imperative that you modify your use for the situation, whatever your situation is, and just be conservative, especially with that one. I hope that answers your question. I've been asked it a lot lately, and I just want you guys to be cautious not to overdo it. Lymphedema aside, if you are dealing with any deficiencies. Let me see here. Mary has lipedema. Her self-care includes LymphaPress, which is a medical grade compression grade pump. There's different styles. Twice a day. I also have a vibration plate, rebounder, and a pool. I also walk using a walker every day for 1 minute. Or for 1 mile, I think you're trying to say, not Mike. Is Mike your husband? I think you mean 1 mile. That's fantastic. And look at how much you're doing. Not everybody's routine is extensive, and you will find your groove and your own little routine over time. It's very, very critical to experiment. And if you've been using your routine or the therapies in the same way for a very long time, sometimes it's a good idea to have a rest and a reset, or mix things up, maybe the time of day or the order that you do them in. Just like exercise, sometimes our therapies or our self-care treatments, you can get into a maintenance phase. You're always doing it the same way. And I know you don't want to veer off, especially once you find a combination that works for you. But sometimes just mixing things up is ways to progress as well. And if you've improved and you're doing as many things as you are right now, Mary, but you've been habitual in how you're doing them, sometimes just mixing up the settings in how you're doing things is enough for your body to go, wait a minute, we need to change and adapt to what you're presenting to us. So great job. Keep moving. When you move, lymph moves. Just be consistent about it. Jody also says, I hope I'm saying your name right, girl. Does the vibrating plate really? Oh, I answered that one about the clots. I hope I answered that one about the clots. If you're dealing with something personal and you want to have a little bit more of a side chat, feel free to direct message me on that or post here in the comments. Mary says, I'd love to join you on my vibration plate, but currently using my LymphoPress while I listen. Ha, ha, ha. So use it for a couple minutes after to recover. Vicky says, I love my massage gun. Yes, I know that you have one and you were using it early on. If you've ever overdone it with a massage gun or pressed too hard, perhaps some of the approaches on the tips I mentioned today offered some insight for you. Vicky says, just did my infrared light belt tonight. Nice. I'm glad you got that. There's many in my groups using the belt for all kinds of different reasons. I'm glad so many of you are experimenting, embracing these things. Jennifer says she is 72 and wasn't diagnosed until 10 years ago. So she spent, and I know this story, but I want to read it for you guys, most of her life eating and under eating and over exercise, which is common. You guys are starving yourself. You need nutrition. And many of you are being led to believe that this is your fault and your situation, and the shaming that goes on in this community simply because it's not known about. It's such an injustice. Since being diagnosed, I realized why none of that ever worked. I love my vibration plate, and I also have a massage gun, both of which I use regularly. Good for you. Jennifer is frequent at being out and about and doing lunches, and she shares her outfits, and she's very interactive with her group, and it's a pleasure to be a part and support your groups overseas. And thank you for joining me here today. And backing up what I'm preaching about Lifepro and the tools that really are just so effective if you guys are using them regularly. Sally says, Sally Dickerson Peters got on late. She's here from Indiana. What was the name of the vibration plate, and can I watch the video from the beginning? As soon as I stop rambling, there will be a recording available in this same space. I don't recommend any one model or setting or frequency for any one condition. I want you, when you're selecting a plate, 2 or 3 really key things to think about. First one, do you want it to be portable? If you lack mobility, if you're weak, you plan on moving it around, maybe you're going to use it in the kitchen during the day, like Debbie suggests, or maybe you're going to move it beside the bed so you can use it first thing when you wake up. I would recommend going with like the Waver or the Mini. They're lighter, they're oscillating movement. Oscillating movement is the primary movement of vibration plates, lateral, pulsation, vertical, whatever else you want to call them. They're an option. They are a variety. All of my coaching sessions are in oscillating because it is the most versatile. It gives me balance and lymph flow faster than other movement styles. And they're also not only more affordable than most types, they're more widely preferred. It mimics how you walk. So most people like how they feel. And if you don't like how it feels, you're not going to use it anyways. So just sharing my experience there. For those of you that have a dedicated workspace, you're looking at doing a bit more of a workout, you may want to lean towards some of the combo models, the Turbo, the Hovert, up into the Rumblexes. I recommend a flat plate surface for anyone dealing with anything chronic, especially hypermobility, inflammation of the joints. It's more how we walk across the floor. We don't walk on a curve. The curves do offer a little bit more resistance. There's a little bit more challenge. So for those of you that are a little bit more fitness inclined, you're progressing in your fitness, you work out now, you like that challenge, you may want to lean towards a curve style. And whether you're looking at them on Lifepro or Amazon, know that they have different names. So if you're not sure which is which, some of those basics may help resonate with you. But one machine with more functions is not necessarily going to give you more benefits. You getting on it and using it regularly is what's going to give you the benefits in the long run. So you can catch the recording on more of my ramblings on that. I hope that helped. And I've got a video if you search the group or any of the welcome posts. I did do a whole session on selecting the right plate for your needs. Dottie Wilson says, hello from Indiana. Yes, I have lipedema. I've been full-time reviver. Got last 2 years ago. My husband passed away, and I'm in a tit. I don't know if that's what you meant to say. Having trouble getting back in the mood to vibrate. I get it. It's hard to get motivated, especially when I'm sorry to hear about your husband. Grief is an ongoing process, and sometimes it's like a death to many when you get this diagnosis, or at least that's how it feels. To some, it's been described to me. Dottie, the best support I can give you is stop beating yourself up. It is not about a big 10-minute thing. And sometimes you just need somebody like me nagging you and trying to motivate you behind the scenes. I would be happy to hold your hand on this journey of resuming to your plate. And I invite you, as I started the session tonight, just start, dancing with it again. Start getting used to it. Put your feet on it while you're watching a show tonight. And sometimes when you start moving and feeling a little bit better, it's that little motivation you need to do it again and move forward. What I don't recommend is jumping back in right where you left off. Give your body some time to get used to it again. But if you're not a member of my group and you do have lipedema or anything lymphatic related, my group is very much, like I say, contradictory in how I use the plates. But I have been doing this a long time, and I'm there not only to teach you how to use them, but to give you that camaraderie and that motivation. And I have a check-in post every week, and many people just check in and say, I didn't do nothing. I haven't done a thing this week. That's okay. Just by admitting today, Dottie, that you haven't done nothing and making a comment and being here and supporting me, I'm getting all choked up. It means a lot. So you are doing something just by showing up today. So thank you for doing that. I hope that makes sense and I don't sound too gushy. It's been an emotional day. Kava, I hope I'm saying that right. Kavia, beautiful name. Can someone please tell me what the warranty is on this item? It depends on the item. You'll have to check with Lifepro, but I do recommend registering your warranty. Some products are a lifetime warranty. Some have a limited warranty. It really depends on the product, but it will be in the product details. And when in doubt, just get someone on the chat or feel free to email Lifepro directly. It's a little bit after hours now, maybe to get the best support. But if you have a particular product that you're looking at, I'm happy to look into it for you, but there's too many different products on Lifepro for me to have it all up here in my brain. So if you'd like me to look into that, please just tag me at Debby with the Y, and I'll happily look into it. Just let me know which product specifically. But most of the vibration plates and the products that I'm showing today offer a lifetime warranty. Dawn says, is it better to wear compression on a vibration plate if experiencing knee pain sometimes? Thank you, Dawn, for asking this question. I have a whole video just on this. Compression is really a kind of. So you might be talking about like a supportive knee brace compression. Maybe you're talking about lymphatic, like prescribed doctor type compression leggings. If you wear prescribed compressions now and your care provider recommends you wearing them for activity, then you should wear them on the vibration plate. The downside when rubber hits the road and reality at home, the real medical grade compressions can be they're a workout themselves, getting them on and getting them off. I would love for you to try it both ways. And maybe, before you go to bed, once you've got them off and things can flow freely, sometimes my care providers say, put them on. Sometimes they say, wear them, take them off. But I don't expect you to be taking these things on and off. It's a whole half day in itself for some of you. So go as you are at the time. So for the symptom management piece, a couple minutes to give you some energy, get rid of some pain, bring the swelling down in those ankles, go as you are. But as you get used to it, I encourage you, after you've spent some sessions on it, experiment for your longer sessions. So if you're doing a workout or you get a whole self-care routine at the end of the night, try maybe a week with the compressions on and then try a week without the compressions on and compare for yourself which is more effective, because I get feedback both way. There isn't like a dominant, it's better with compression. For the most part, I will say my long-term users that are experiencing weight loss, toning, improvement, shape changes, some of them prefer without. It really depends on your experience using, but start as you are and progress as you are and experiment once you feel comfortable. I hope that makes sense. Kevia also says, is she answering questions on here or is she just talking? I am trying to answer questions, but there's a lot of them. Sorry to ramble off on that. Just my style. Irene says, Debbie, is there a list where a person can go to get a diagnosis of lymphedema? There is not. I wish there was a list that I could provide for those of you that are seeking. Sometimes in the US in particular, it is a per state thing. So, certain states, it's a vascular surgeon. Certain states, it's an endocrinologist. So it's not necessarily this country, this type of doctor. It is, I know in the US, it depends on the state that you're in. And the country has to acknowledge the condition. So unfortunately in Canada, areas of, I think in the UK, you can get a diagnosis. I think you can in Australia, but it's when you go to take that diagnosis and seek, maybe some care that it gets a little bit more challenging. So it really does depend. Probably the best place to start is speak with any certified lymphatic therapists in your area. Not all of them are in a position to diagnose them, but because they are that hands-on working with the lymphatics, many of them may be aware of the condition and may be better versed. And asking your groups online, there's a lot of the Facebook groups and the social groups online have their own lists, and they can navigate you depending on where you're located. I hope that helps. Can somebody tell me what the warranty is on this item? Kivia, which item is it that you're looking? I'm really trying to be helpful here, but the theme of today is lipedema awareness, and I've got a lot of people asking questions. So if you're asking about the vibration plates or any of the products that I've talked about today, I believe that they are a lifetime warranty, but it is different depending on the product that you're looking for. So I'd love to answer your question, girl, but which product is it that you're asking me about? I'm a vibration plate specialist. I do not work for Lifepro. So you may have to speak with them directly. I'm really just trying to answer your question, but I need a bit more information. And if I haven't answered your question, I apologize. I am doing my best here. Kevia is now replying saying, Mary, do you know what the warranty is on the device by any chance? Which device, Kevia? Where you're now disrupting others that are trying to get their questions answered. I'm not trying to be rude, but it's like I'm not here trying to help you, and I am. I'm going to say lifetime warranty on the vibration plates. Kevia, if you could please tell me specifically which product it is that you'd like an answer on, I'd be happy to answer that for you. Kevia, you're not really hearing me here, and I feel like I'm being rude to everyone else now. So I've still got 11 of you here. If any of you have questions related other than a warranty question to the products that I'm speaking about today, or lymphedema in general, and you're watching this on a recorded basis, please just tag me at Debby with a Y. If you have product-specific questions, and Kevia, I hope I'm saying your name right. I can't really answer directly because it also depends on what country you are obtaining these devices on. So if you're going through an Amazon, check with Amazon on the warranty. That's who you're purchasing from. But for the most part, all of Lifepro's products have a lifetime warranty. Be sure to register your purchase within 7 days. That is kind of the key. So for those of you that are just recently purchasing or have gotten a product, please make sure that you register the warranty. But I do believe, Kevia, to answer your question, most of them are a lifetime warranty, and what that means is absolutely what it means. They will replace it if you have an issue within the life of you owning it. I hope that's answered your question. For everyone else, thank you very much for joining me today. I'm going to give everyone, if you are trying to post a question and you don't see it appearing here, make sure that you're on the main Lifepro page, not the VIP group. Private group posts no longer come through on these feeds. So make sure that you're on the main VIP group. Can you tell the difference between the flat one and the curved one? Again, I'm looking to have an intense workout, so I would like the one that is more intense. Kevia, I don't know if you actually have lipedema. If you do have lipedema and you're fit, good for you if you're working out regularly. Any of the models with the curve will present more challenge. Flat is more functional, and that's what I recommend for a lot of the inflammation and hypermobility that we're dealing with here. Kevia says, thank you, I will. I'm looking to purchase the vibration plate with intense speed and wide base. Can you tell me which one is the best for what I'm looking for? You know, honestly, Kevia, I'd really prefer that you listen to the last hour and a half, because I've provided that information. It's not about standing wide. It's not about going as fast as possible. That completely contradicts everything that I'm said here today. And I'm really just concerned about you overdoing it and hurting yourself. So if you are dealing with lymphedema, taking on max and time and intensity, you're going to set yourself up for some pain and some disappointment. But to answer your question, if you're looking at purchasing a plate that has, you know, the most bells and the most whistles, I recommend the Lifepro or the Lifepro Rumblex Pro model. I would go with Lifepro Direct because they've got a sale on it right now, and you can check that out through their site. I'm sorry that I'm seeming a little bit short, but you're coming across upset with me, and all I'm really trying to do is answer your question here. I didn't know. Thank you for helping me out for a minute. I didn't know that you were seeing my messages, so please forgive me. I just don't want you thinking I'm upset with you. I just thought that you thought that I was ignoring you, and I'm not here to ignore anyone. So on their site, you're going to see it looks the largest. It's also the most expensive. The only model above that, as far as bells and whistles, is the Relaxa Vibe. The Relaxa Vibe is more like furniture with function, is how I refer to it. It is a flat surface, but it is the largest surface plate, and it would be ideal even as an ottoman in your living room. It's got a heated surface, but it does have a flat surface, but it has the largest surface. So depending on what you're looking for, but it comes with a whole kit of straps, accessories, and there's lots of exercise related videos if that's more what you're looking for. That there's lots more, and I will post at the end of today's session my list of sessions that I've done for Lifepro. And if you're looking for lipedema specific information today, anything I've quoted is from the site lipedema.com. You can also check a lot of this right on Wikipedia and through Google yourself. For those of you that have listened to me ramble for an hour and a half, kudos to you. Thank you very much for your patience. Kevia, I want to stress, if I sound short at all, I apologize. I was very excited about getting to today's session, and I hope that I gave you the information that you got. A lot of times on these sessions, especially when they're of an awareness nature, if you're coming in partway through, you may not be aware what the audience that I'm addressing. And I just want to make sure that if you are dealing with lipedema, that you just don't overdo it. And that lesson applies to everyone. Be conservative, use your tools often, combine the tools to get more results in less time, and be prepared to adapt for those good days and bad days. There is no one path to success, whether you are dealing with just managing symptoms or you've got other long-term fitness goals, health goals. And over time, things change. What maybe didn't work for you last time is perfectly tolerable today. And, maybe the last time you tried a sauna, it was totally intolerable. And now maybe things have changed and you're cool with it. Maybe you're going through menopause like me and you're a little bit hormonal. I'm sure that came through a bit today, but thank you very much for joining me today again. Thank you for being here to support me as well as Lifepro. June is Lipoedema Awareness Month, so I will be doing some more posts in the group reminding you about today's session and past sessions that I've done. For those of you watching this on the recorded basis, or you just don't want to hear me talk anymore and you'd like to ask me a question, please put a tag at Debby with a Y in the comments. That's the best way to make sure I get the notification. If you're watching this afterwards and you have lipedema, or you have, some self-care ideas you want to share, please continue to comment on this video as it circulates out. And I will take a look and address any comments after the fact. But let's keep this at the top of the feed for Lifepro, for those that may not be aware that they're dealing with this condition, and invite them into this community and introduce how wonderful self-care can be in managing this condition. So I just wanted to empower you guys today. Peace. Wear your purple. Thanks, Carmen, for the t-shirt. And I look forward to seeing feedback from those of you. If I've missed anyone, I completely apologize. I think I've gotten all the comments in here, but keep those comments coming, and have a great rest of your week. There's lots of events going on this month, and I'll be sharing a few more, not only here in Lifepro's group, but in my own as well. Thank you guys for joining me today. Have a great evening. For those of you that are shopping deals or looking for plate ideas, I will post some recommendations here over the next hour. Based on what country you're in, there may be different availability and different deals. So I will drop some international links for Lifepro and where you can find access, both in Lifepro's group and in my groups. Have a great night, guys. Thank you so much for being here and putting up with me for as long as you have. Thank you again, Kevia, Mary, everyone else that joined me today, Jennifer, Vicky. Thanks for your support, and keep moving regularly. Have a great night, guys.